Okay.
Good morning, everyone. I am Jeb Bradley from Senate District 3. Today, we're holding a meeting of the Senate Health and Human Services Committee. Before we get started, let me read through a checklist to ensure that the meeting we are holding is in compliance with the right to know law. As chair of the Senate Health and Human Services Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12 pursuant to executive order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that 1, we're providing public access to the meeting by telephone with additional access possible by video and other electronic means. We're utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube via phone by following the directions and links provided on the general court website. 2, we have provided public notice of the necessary information for accessing the meeting in the Senate calendar. 3, we are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate, all one word, remotesenate@leg.state.nh.us or call 603-271-6931. 4, in the event the public is unable to access the meeting, it will be adjourned and rescheduled. 5, please note all votes taken during this meeting shall be by roll call. And 6, finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, all of which is required under the right to know law. So let's begin. We'll start with Senator Gray.
I am James Gray. I'm here in the State House and I'm alone in this room.
Senator Sherman. Muted.
Unmuted. Senator Tom Sherman, I am in my home in Rye and other people are in the house, but I'm alone in the room.
Senator Whitley.
Good morning. This is Senator Becky Whitley. I am in my home in Hopkinton. I'm alone in the room, but my husband is in the house.
And Senator Avard.
Senator Avard, you're in my office in Nashua, New Hampshire. We have a couple of dogs in the room, and that's it.
And Jeb Bradley, I am in the 3rd floor Senate offices and alone. Okay, is there a motion to go into executive session?
So moved.
Second.
So Senator Avard moves, Senator Sherman seconds. Senator Avard,
Yes.
Senator Sherman,
Yes.
Senator Whitley,
Yes.
Senator Gray,
Yes.
and I vote yes. Okay. We're still waiting on a corrected version of the amendment for House Bill 143 that dealt with the mental health licensure issue. Hopefully we get it back from OLS, but let's start with the other bill, which is House Bill 220 first. So I'm going to recognize Senator Sherman to introduce an amendment.
Yes. Let me get the amendment number. Maybe could Kirsten put it up on the screen?
Yep. Mm-hmm.
Yes. So Senator Sherman, I received another version from Jenny this morning. Is it the most recent version or?
No, there's two
There's
separate
two.
amendments. So
Okay.
the first one, which is similar to the Bradley amendment, just more brief.
So which one do you want me to bring up?
Let me get the number. Hold on, sorry.
I think it's 1564.
Yeah, that was the first one, and then the most recent.
That's the one, right.
Okay.
1564 is the. All right. So, do you have that up?
I'm pulling it up just now.
Okay, sorry, I'm jumping around on my screen, so I'm. All right. So the idea here, I'm just going to speak to sort of the global concept where I ended up with on this bill. HB 220 is, and I had a delightful discussion with the prime sponsor last night. And I believe I understand the trigger for this bill. And what's interesting is the trigger was an issue with vaccinating foster care families or a child going into a foster care family. And so, it's the problem with the original bill, which I think Senator Bradley and I and others are in agreement that this is not, that it's probably more than is needed, was that it basically reopened over a decade of work that many of us have done on the issue of vaccination in general. It also went into all medical treatment for both adults and pediatric patients. And this was in response to a single incident when the prime sponsor was on jail car and had a difference of opinion with DHHS on requirements for children who are being placed in foster care. The other major driver this session for addressing vaccines is concern about COVID. And part of that concern I completely get, which is that this is not fully FDA approved, that it's on emergency authorization, and that people are reluctant to get vaccinated. And I was on actually a hearing yesterday where they were introducing an amendment in the House to one of our bills from Health and Human Services. And what strikes me is they had people calling in from all over the country, and it just wasn't true. What was being said by these supposed experts, one of whom happened to be a pathologist. So rather than rambling, what I get is that there's a concern about how DHHS makes its rules regarding vaccination. And I believe that that typically can be settled with a working group or a committee, very specifically targeted to the question, and that DHHS really responds to this well. I also believe that there is concern about COVID and the COVID vaccine, at least until it's fully vetted and has gone through the full FDA approval process. I get both of those things. So what this amendment does is it's very similar to Senator Bradley's amendment, but it does not broaden it out to medical treatment. And it really focuses on the intent of the Bradley amendment and the intent of the prime sponsor, which is that this is all about not having anyone be forced to get a vaccination by the government. And, I agree with that. I don't think anyone should necessarily be forced to get a vaccination. But I also don't believe it's our role to tell businesses and private entities how they should do their own business. If we go down this slippery slope, we will be telling businesses, virtually everything they can and can't do. And the businesses have a compelling need to protect their employees and their customers. And I believe those issues and decisions should be left to the businesses. And I think the governor has agreed with that in his orders, certainly in the gopher opening, the reopening committees. It's really the businesses have been given the ability to continue masking, continue social distancing, continue whatever level of precautions they feel are necessary to keep their employees and others safe. So this amendment is very specific. It says the government in Roman 1, it reiterates the exact same thing that that actually is pretty much standard for healthcare. But it also says that it will not allow the government to compel someone to be vaccinated. It also, and then it goes through, and in the end, the committee that Senator Bradley set up in his was a broad committee. I don't think we need to revisit every aspect of vaccination in the state of New Hampshire. We have done that over and over and over again. And I think we have come to an area where, yes, we may need to tweak rules and do that kind of thing, but reopening the entire process of vaccination, to me, would be a mistake. And that's why this limits the charge of the committee to the COVID vaccine. I realize that there are people who even this is too much, but this version is something I could live with and vote for. And I would ask for your support for it.
So are there any questions of Senator Sherman?
Yeah. Line 28 on section 3, the Department of Corrections may mandate medical treatment or immunization for inmates when a direct threat exists as defined. So these can be involuntary immunizations.
Well, actually, there are exceptions, A through E. And that's also true of Senator Bradley's as well.
I was looking for it in his, I didn't see it.
No, it's there. Are there other questions for Senator Sherman? Senator Whitley.
I'd like to hear from you, Senator Bradley, since it's competing against your amendment.
Yeah, you will. I thought that if there are any questions of Senator Sherman, we'd get to them. And then I think I'd ask Kirsten to put, I don't know if you can put two amendments next to each other on the screen or not, but.
I can't, I don't know. I'll try. I don't think I can though.
Okay. Senator Whitley, did you have a question of Senator Sherman?
Yeah, thank you, Mr. Chair. And thank you, Senator Sherman, for your work in trying to seek a compromise. I do think, having a committee looking at this issue is something I can certainly support. But I continue to feel that existing law already contains adequate protections for medical freedoms and medical liberty. And I think any interference with this current delicate balance we already have in state law is problematic. So I don't think I could support, if it had this additional prohibition. But certainly if this committee, I think, is a great idea.
So if I can answer that, I think this issue probably could have been settled. This specific issue of foster children probably could have been settled by calling up the commissioner and sitting down with the appropriate people, which is Senator Bradley and Senator Gray and I, and I'm sure Senator Avard and you, Senator Whitley. We've all had that experience where we have said, I don't really like the way this is working out. I'd like to sit down with you and see if we can work it, figure it out. And one example for foster care would be if the child is able to be vaccinated, then, and it is a vaccine that shows very high level of immunity, maybe they could go in with a family that's not vaccinated, that's using precautions. In other words, have an exception with an individual review rather than having a blanket policy. That would be, I'm not saying that should be, but that could be one possible compromise that would have avoided having a bill come out, HB 220, that would be far reaching and impact not just the one issue with foster care vaccination, but vaccinations all over. My preference on this bill is to re-refer it because I think it is absolutely not ready for prime time.
I would agree with
But-
that. I would agree with that, Senator Sherman, that it sounds like there's, of course, merit here, but more work needs to be done. So I would support that re-refer.
But the problem is, this was an attempt to say, okay, let's be very specific, very targeted. Let's not open the entire universe of medical treatment. Let's not open the entire universe of all vaccines, which all of us have worked on previously. And let's keep it laser focused on the only vaccine that is currently in wide use that doesn't have formal FDA approval. That I could live with. So in any case, that's where I landed.
All right, further questions of Senator Sherman? All right, Kirsten, why don't you put my amendment up on the screen?
Sure. And I did find a way to show both at the same time. So did you just want yours
Oh,
at the
great, yeah, put them both up at the same time.
Okay.
The question is, will they be readable?
That's a good
I don't know
question.
if I can make it much bigger.
Okay, so that should be sufficient. The significant difference is on line 11, starting in section 1 of the bill. Our lovely faces are blocking my amendment, but I think everybody has seen it. I just want to point out what the differences are. So I also have had constant communication with the prime sponsor, but not just that. I think as Senator Sherman noted, what's going on in the House on Senate Bill 155, and I think there may have even been other bills. I could be wrong on that, but with amendments being introduced there that go well beyond what the House passed in House Bill 220, I've really felt it was important to find a compromise that hopefully people can live with. And I think my amendment better reflects the compromise. So the main difference is in my amendment on line 11, it says, as Senator Sherman's does, every person has a natural, essential, inherent right to bodily integrity. My amendment goes on, free from any threat or compulsion by the government to accept, etc., including immunization. I think that's important to put in at a time that, or at any time, that people are worried about compulsion. And whether it's immunization or medical intervention, I think that's an important statement, especially in light of the privacy constitutional amendment that was passed by the voters, I believe, in 2018. So my amendment goes on to spell out that no person may be compelled to get the COVID-19 immunization, and it lays out the political subdivisions, et cetera, et cetera, et cetera. Then, and Senator Sherman's amendment and mine are the same going further down the page. And this is also the House passed version of the bill, starting on line 18. Doesn't limit the commissioner's authority under the communicable disease statute. It doesn't supersede the vaccination requirement for schools. That's B. C, it doesn't supersede the involuntary admission procedure for mental health. And lastly, for guardians in D. So moving on in my amendment onto the second page, it makes it clear that we are talking about government-run facilities in E, when you say it shall not apply to county nursing homes, the New Hampshire hospital, or any other medical facility or provider operated by the state or a political subdivision. I think that's important in light of what we've seen in medical facilities. Remember, this amendment is about government compulsion. It's not interfering in what private employers seek to do. It's government. And that's why I included section 3, which was in the House passed version of the bill, that it may mandate medical treatment or immunization for inmates. I know that, you know, there may be some consternation about that. My answer to that is during the COVID pandemic, inmates were being released from prison because of safety concerns. I don't think that, personally, I don't think that's appropriate. The one change from the House version is a different CFR section. I asked Rick to look at the CFR, and this section relates to public accommodation, which is much more appropriate for the population of inmates that we're talking about, as opposed to the House reference was an employment federal statute. So I guess there may have been some differences in the study committee. I hadn't gotten that far. So I hope that, and I know that Senator Sherman probably has some angst, and Senator Whitley too, given that hopefully we can get a compromise that is realistic, that the House can live with, that applies to government only, that doesn't go further than that. I think this is a good amendment, and I hope we will pass it.
Senator Bradley.
Yes.
So I have a couple of questions on this. You've opened it up to medical interventions, and this does not distinguish between adult and pediatric, which was one of my fundamental issues with the original bill. So it persists with this bill. And Kirsten, if you can drop down, go back up to Roman 2 in Senator Bradley's bill. I think it's Roman 2.
Those are the exception pieces.
I'm sorry, back up to Roman 1 then. The intent here is that this is to be implied just on the government, but the government has an obligation to protect children. And part of that is if there is, and the federal example is if there is an available curative chemotherapy agent that's available for a child with, say, a lymphoma or a leukemia, and the parents want to whisk the child off, this was a real case, off to Mexico and use an unproven, untried one. The government, just like in child abuse, has the ability and the need to step in and be able to protect that child and save their life, essentially, by getting them the appropriate treatment for their diagnosis. Your bill or your amendment actually includes children in this and steps away from that both federal and state obligation to protect children by saying every person. And then it also, and that's a medical intervention, any medical intervention. So with due respect, the implications of this, and actually, I know the Medical Society is here and would love to speak on your amendment if you would allow. But this is a really deep concern I have, is that we are basically taking away the ability of the state to intervene on behalf of children when the guardian or parent or other person in that position is saying, I will not do appropriate medical intervention. And so that's
Senator Sherman, I'm
a
not
huge concern.
sure you're correct. If you look at the statute, the underlying statute that this bill is amending, the definition section of communicable disease specifically says a child means any person between birth and age of 18 years of age. So I'd want to talk to our lawyer, Rick, but I think that's a carve out.
Well, Senator Bradley, I think to put a finer point on Senator Sherman's point about protecting children, setting aside those cases where a parent may make a particular decision about a child, but thinking about those situations where we have children in state care. So foster children, children at the Sununu Youth Services Center, children in state care. I'm concerned that this amendment interferes with the state's ability to keep children safe who are in state care. And I think further, apart from the children's issue, we already have protections in law respecting bodily autonomy. And that's incredibly important. And I will say, as a woman, bodily autonomy, the ability to make medical decisions for myself, is very important. So I will say that current law has adequate protections, and I just don't see the need to interfere with these decisions. I mean, I feel like current law creates that balance between protecting public health, protecting children, and I think any sort of messing with that balance is really problematic.
I also think that the need to go and consult an attorney is really, the recognition of that need is also a recognition that this is really not ready, that we are coming up against a deadline, and any other time we would be re-referring a bill like this so that we could really get it right. So I remain concerned that we're passing something that we just really don't fully understand the ramifications of it. And I'd love to hear from the medical society on their concerns, since they are the experts on immunization.
All right, I'll recognize them in a moment. Is your Second Amendment, Senator Sherman, something that defines what person in that line 11 is, like a person 18 years and older?
No, but it's not. But this is focused on the COVID vaccine alone. So this does not reach into medical treatment. It does not reach into other things where you would need to delineate adult versus
I
pediatric.
thought you might be amending my amendment if your amendment fails, is what I was getting at.
I would love to amend your amendment.
All right. All right, let's bring in the medical society. You get 1 minute.
We bring in, is it Michael Padmore?
Mike Padmore, yes.
Okay. Oops, wrong one. There we go.
Thank you, members of the committee. This is Mike Padmore, for the record, Director of Advocacy for the New Hampshire Medical Society. We do have Dr. Gary Sobelson on the line, and he is a practicing family doc in Concord, and certainly has been engaged on this issue. So if it pleases the committee, I would love to defer my time to him.
All right, that's fine.
Thank you, Chairman, and fellow senators. I think Senator Sherman has outlined most of our concerns. I think you're hitting into the very important topics. We as a medical society are very concerned about the public health compulsions that are present here that could be lost. So healthcare workers, food workers are subject to a number of compulsions that we do not think should be removed. We also read this bill as being—
And Dr. Sobelson, this doesn't apply to them, that if they are working for a private employer.
Well, Senator Bradley, quite respectfully, and that part of the language is our greatest concern here. We read this bill as not the way in your amendment, not in Senator Sherman's amendment, as really not addressing that question. It certainly does seem to extend all of these to private enterprises, to churches, to businesses, to various non-governmental entities. And the language seems very clear to me. Again, I don't want to in any way be disrespectful to it, but that is our main concern and the reason why we do hope that you would re-refer unless Senator Sherman's version is acceptable by limiting government's role. Thank you.
Okay. All right. Thank you. Tim Lang is also wants to address the committee briefly as the sponsor of the bill, so I'll recognize him.
Okay, and I'll bring in Representative Lang.
Morning.
Good morning, gentlemen. Thank you for letting me speak real quick. I've had the chance to overview both Senator Bradley's amendment and Senator Sherman's amendment. And I have to be honest with you, the original intent of the bill, I think that Senator Bradley hit the nail right on the head of limiting this to government and keeping government COVID passports and requirements across a broad spectrum. Again, making government be able to mandate on 1.3 million people in New Hampshire. I think that was the original intent as I spoke. And, and I do think we have a problem. Again, we saw the first time I saw this rear its head was the original intent of this bill was around the foster care families, where rather than create a specific rule that dealt with children that might have compromised immune systems, DHHS chose to do a broad statement and say that if foster children have to go only into families that are vaccinated, and thereby creating a mandate on every foster family that's out there or potential foster family. There's been several people have contacted me that said they've been excluded from participating in the foster family program because of the fact them or one of their children in the house are not vaccinated. So I wholly support and get behind Senator Bradley's amendment. I spoke to the House in our caucus, and they agree with this amendment. They like limitations that were put here and the cleanup that Senator Bradley's done, and I wholeheartedly support it and hope the committee would do it. I do have concerns with limiting it strictly to COVID, and that will be back to address this again, because again, that doesn't address the issue that we saw DHHS do with foster families, and we shouldn't, by starting to narrowly define this thing and say it's COVID, and then changing it next year to be whatever the new latest greatest virus that might be out there be, and have to keep coming back. So I wholly support Senator Bradley's amendment, and I'd ask you to please vote to adopt that amendment.
All right, one quick question, Senator Sherman.
A quick question for Representative Lang, and thank you so much for being with us, and thank you for taking my call last evening. While my version would limit to COVID, the lessons learned through COVID and the ability to extrapolate that out further for any future viruses and vaccines would be something that the committee could do. So would you not agree that there actually is wiggle room in my amendment to take the lessons of COVID in the committee and extrapolate that out so that any future viruses down the road, we can be sure that we're not running into the same controversy that we are with the COVID vaccine, rather than revisiting all vaccines, many of which, have been shown to be, virtually all of which have been shown to be life-saving. But this would still allow us to learn the lessons of COVID, make sure we don't repeat any mistakes that may have been made, and make sure we're respecting the autonomy of adults and children in terms of future vaccination programs.
So thank you, Senator, for the question. I'll quickly answer it in that if I remember reading your amendment right, and I don't have it up in front of me, but you actually limited in there, you talked about COVID vaccines, and the committee studied COVID vaccines. And again, I thought that was a limiting factor, that if a committee would have tried to expand that to talk about vaccines in general, that would be outside the purview as I read the bill and as I read the committee assignment. Whereas Senator Bradley's statement is more broad, talking about medical interventions, including vaccines in the committee, that allows you to look at the potential going forward for any other changes or adoptions that we might want for future legislation. I'm just, again, concerned that you've narrowed it down so specifically to the COVID vaccinations and the COVID virus that it doesn't, it doesn't address the bigger picture of mandates by state agencies on to require vaccinations in certain circumstances.
Senator Bradley, may I just clarify that for a second?
Okay, one more.
So this isn't really a question since we're in exec session. This is just a comment that lessons learned from COVID would absolutely be something that would be the purview of this committee, and that would be the legislative intent. I'd be happy to revise my amendment to capture that if that would be helpful.
Okay. Anyone else have any questions, comments? I'm gonna let Senator Sherman introduce his amendment. So when we get to voting, it'll be on his amendment and we'll see what happens. Senator Whitley.
It would be helpful to hear from DHHS on the amendments as well.
Is anybody from the department here?
We have Abigail Rogers.
Okay.
Hi, Senator Bradley and members of the committee. This is Abigail Rogers. I'm the legislative liaison for DHHS. Happy to answer any questions. Good morning. The department's happy to work with the committee on looking at the amendments further. We, just as a frame of reference, we did oppose the bill originally when it was in the House. We worked with Representative Marsh to, and he agreed to put our authorities that are so important to us to protect public health back into the bill before it passed out of the full House. Appreciate the committee's work on the bill. Beth Daly was going to attend. She obviously has other engagements this morning. She could speak more to the specific amendments. So we're pleased that our authority is still recognized and included in both Senator Bradley's amendment and Senator Sherman's amendment. And I think that the idea of the study committee would be give the opportunity to have further discussions on a complex issue. Granted that the original legislation was written before the COVID vaccination was available, it does open the opportunity to have further discussions with the department and stakeholders on how to best move forward looking at this complex issue. So I would say that we appreciate the ability to comment today, and if there are any questions, I'd be happy to answer them to the best of my ability.
Senator Sherman.
Yeah, I have a question. Thank you, Abby, for coming, and Abigail. And I'm concerned that we may not have an answer to this, but when I look at lines 13 through 17 of Senator Bradley's amendment, and this is one of the reasons why I removed this, is any public facility, any public benefit, or any public service. Do we not have numerous publicly accessible facilities, benefits, and otherwise where currently, say for example, in state parks, we have facilities, in others, we have facilities where the public accesses it. And if the government, if DHHS was not able to have some sway over the public health policy of those facilities in terms of vaccination or any medical treatment, that the public could be actually put at risk? Or do you feel that Roman II captures all the exceptions that you would need to be able to still compel employees to have whatever vaccinations would be needed to keep the public safe?
Sure, thank you for the question. I believe that public health looks at all sorts of protective public health protection measures when looking at public spaces. That was a key reason why we had recommendations that we took from the CDC about social distancing, mask wearing when appropriate. And now there are new recommendations that have come out both from the CDC and from the state on that. I think that that would be a really good question for Beth Daly to answer. Unfortunately, she's not here at the moment, but we feel that nobody mandates vaccinations, and we would definitely use the best public health guidance available in public spaces to protect, to protect people when they're out in public.
Follow up.
Okay.
So since Beth is not here, since we have questions for Rick Lehman, and since we're coming up against a deadline, would the department prefer that we re-refer this so that we can get it right and not put in jeopardy the public health because we're trying to rush through a bill?
Well, it's certainly the committee's decision on the legislation. I would say that there are many stakeholders that could be involved in a further conversation that would be able to inform the committee on some of the questions that have been asked here today.
Thank you.
And they're not available here. And I think that the idea of a study committee to have all those voices at the table to properly vet and move forward on a well-intentioned piece of legislation would be advisable, but I would leave that up to the committee members to decide.
Okay, thank you. Thank you very much, Ms. Rogers.
You're welcome.
All right, so I'm going to recognize Senator Sherman for a motion on his amendment 1564.
I move ought to pass on the amendment. I'm not sure I'll get a second, but it's.
No, I think Senator Whitley will probably second it.
Well,
Right.
We'll see.
I just have
She
a
should not feel any pressure. So I
have a question because I don't think we had moved ought to pass. And so I would say that the first motion should be on the re-refer as we've discussed, because there hasn't
Fine.
been.
I'll go ahead. Senator Whitley moves re-refer. It's a higher motion.
I'll
Senator
second.
Sherman seconds it. Okay. I don't think we need any further discussion on that. I'll call the roll. Senator Sherman,
Yes.
Senator Whitley,
Yes.
Senator Avard,
No.
Senator Gray. You're muted, Jim.
Sorry about that. No.
And I vote no. Okay. Now I'll recognize Senator Sherman for a motion on 1564.
On my quixotic, is that the right word? Or quixotic motion, I move ought to pass on my amendment.
Okay. And seconded by Senator Whitley.
Sure.
Okay.
Thank you, Senator Whitley.
All right. So we'll start again with Senator Sherman.
Yes.
Senator Whitley.
No.
Senator Avard.
No.
Senator Gray.
No.
And I vote no too. Okay. Senator Sherman, did you have a second amendment that you want to introduce?
Well, I would, I'm not sure I can do, I would like to introduce the amendment that puts in the collaborative care. I don't have the amendment number and I can speak to it. You want to hold off on that?
Let's, yeah, we need a conversation on that. Okay.
Okay, that's fine.
I move ought to pass on your amendment, Jeb, 1471.
All right. Is there a second for that?
Second.
All right.
Could I offer a committee amendment to your amendment before we vote?
You're free to discuss it.
I would, Kirsten, are you able to bring that back up? Just the Bradley amendment?
Sure.
Okay. With a lot of respect for all of my colleagues, I am deeply concerned about any mention of medical intervention. And so I would ask Senator Bradley if you would be willing to remove any medical intervention, comma, including, and then just have except immunization instead. I think we are going in a direction that really puts at risk something that we have not considered, or certainly not given adequate consideration to. And goes to the very root of medical ethics and a state's obligation to protect children and adults who cannot protect themselves. This is broad sweeping. It includes any medical intervention. I think the main thrust of what the prime sponsor was looking at was vaccination. That was the trigger for this bill, but this goes way too far. And so I would ask respectfully that throughout the bill, and I can't remember if there are any other parts of the bill that have the words medical intervention, I would limit this amendment to vaccination. And I hope that the committee will agree with me. I think the committee that is looking at this could continue to look at, if nothing else, they could continue to look at medical intervention if you wanted that to happen, because it's your amendment and I'm going to vote against it. But I'm warning the committee that you are opening a Pandora's box, which once opened may not be able to be closed. And I am concerned that the department has not been able to adequately address the concerns that I raised about lines 14, where it talked about any public facility, any public benefit. These are hugely broad. And I think, again, we are opening a Pandora's box. So I would respectfully ask that
So Senator Sherman is moving that on line 12 of my amendment, we strike the words to accept any medical intervention, and I think including.
I think it's just medical intervention including, because then that leaves accept any immunization.
Yeah. He's all right. So what Senator Sherman is moving is to delete the words medical intervention including. Okay. Is everybody clear on that? And that would be a committee amendment if it passes. All right.
And I don't know if Kirsten could scan down just to make sure there aren't any other references to
it's
that.
in a couple of places. It's also in the study. If your amendment passes, Senator Sherman, it really should stay in the study.
Right.
I think you should just make your amendment to section 1 of the bill.
Okay.
I'll
All right.
second that.
Is everybody clear on that? We would strike the 3 words on line 12. Any medical intervention. And I believe
it's medical intervention including.
And I believe that's the only place it is, actually. I misspoke. Okay. All right. Senator Sherman on the roll call.
Yes.
Senator Whitley.
Yes.
Senator Gray.
Yes.
Senator Avard.
No.
And I vote no too. All right, so we have a 3-2 vote to strike the term any medical intervention from Amendment 1471.
Senator Bradley,
Yes.
line 15 of page 2 still contains medical intervention, and that's one of the reasons why I voted the way I voted. that it's still. one
That's
of
in the study committee.
Right.
Yeah, and that's fine. I get it. I just don't want it happening without it being looked at.
I-
All right, are you seeking to reconsider?
No,
Jim?
I just was mentioning, there was discussion as to whether medical intervention, was listed anywhere else in the bill. And they're still going to do,
In the study, yes.
right.
Okay,
And so having it on page 1 didn't seem to be a deal breaker for me.
I see what you're saying. I understand you now. Okay. All right, so the committee has struck those 3 words on line 12. Is there now a motion on the balance of the amendment 1471?
I second your motion to ought to pass, Senator Bradley.
I think it was Senator Avard moved the balance of the bill ought to pass, right, Kevin?
Yes.
And it's seconded by Senator Gray. All right, we'll call the roll again. Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Sherman,
No,
Senator Whitley,
No,
and I vote yes. All right. So the ought to pass motion goes forward 3-2. Kevin, Jim, you want to take it out or you want me to take it out?
I think you should take it out.
Okay, I'll take this one out. Okay, great. Give me 1 second to organize my pile of papers.
Senator Bradley, I just want to clarify for the record. So the motion, I'm sorry, we're ought to pass as amended on 1471 with the committee amendment?
It's that the committee amendment struck the words medical intervention including
Yes. And then the committee adopted your amendment 1471.
without those 3 words.
Yes.
Yeah.
Okay.
That-
And then,
did we do an ought to pass as amended? Was that what you were looking for, Kirsten? Because
Yeah, I
we
don't
voted on
believe-
the amendment.
Oh, I'm
With
sorry.
the-
You're right. We didn't do that. All right, I'm getting ahead of myself. Senator Avard moves on to
Move on to
pass as
pass.
amended
Yes.
and seconded by Senator Gray. I'm sorry. All right, Senator Sherman,
No,
Senator Whitley,
no,
Senator Avard,
Yes.
Senator Gray,
Yes.
and I vote yes. Now we will assign me to take it out. Okay. All right, shifting gears to House Bill 143.
But before we go, shift the gears, Senator Sherman did submit, at least we got a copy of his new amendment, which would have been 1567. Could you explain to me, I think it's 22 pages when I looked at it, what you were
Yeah.
trying to do?
I'm happy to. Should I go ahead and explain that, Senator Bradley? Because I think I'm not going to introduce it after all. So,
I'll explain it because I probably can be briefer. It's the subject of a bill the Senate passed dealing with collaborative care model. I can't remember the title of the bill. I believe it has been retained in the House.
it was
Correct,
actually
Senator
killed.
Sherman? It was
No, it
actually
was-
killed. And Senator Sherman wants to reintroduce it. My advice at this point to Senator Sherman is, I think we need to talk to some of the House members. And I don't think it should go on this bill in any case on 220.
All right, thank you for that. I've got that while I was driving in, and then when I looked at it in 22 pages, there was no way I was going to read it in the 2 minutes left. I had to log in. So
Right, and the Senate position was unanimous in support of that bill, and it was, the committee killed it. It's not gone to the full House yet.
thank you for your accommodation.
Okay, let's move to House Bill 143, and Senator Whitley moves on to pass. And now we can introduce the newest amendment, because the amendment that we all received last night, 1566, had one section that was incorrect, which the newest amendment Kirsten has, and it's going to have to put up on the screen, and we can go through it. And you know what, Kirsten, if you can bring in Michelle Merritt, that would be helpful if she's on this Zoom.
See, I'm not seeing her on here.
All right, you know what, let's take a 2-minute break, and I'm going to see if I can raise her.
Kristen, can you send the latest version?
Sure.
Thanks.
Okay, I just sent it, so you all should have it now.
All right, I've texted Michelle, and she is going to log in. So why don't, Kirsten, you put on the newest amendment on the screen.
Sure. I just can't let Michelle in to talk while I have my screen sharing.
Oh, all right.
So I was just going to wait a moment until she came in.
Okay, all right, let her in first.
Okay, thank you.
Senator Bradley, can you just share what the difference is between 1566 and what Kirsten just sent?
So this is why I wanted Michelle to be on the call. I have not actually seen the newest amendment because I sent the language that was not correct in, I believe, section 7 of the bill that deals with the licensed social workers, initial license. And as I'm reading what was sent to me this morning, I'm not sure what the difference is, which is why we need Michelle to be here.
Oh, Michelle's here. I'll bring her in right now.
Good morning, Michelle. How are you?
Good morning, Senator. I'm doing well. How are you?
Good. So can you just walk us through the language that you sent me this morning that was not the correct language, so that we make sure that we have the correct language?
Sure. So in the amendment 1566S, if you look at the licensed social worker, so I believe this is new section 6, it says in the language in this amendment, it lists out a variety of different bachelor's degrees for this credential. That's actually not accurate. The model from the National Association of Social Work Boards keys the LSW actually to a bachelor's degree in social work from an accredited college or university from the Council of Social Work Education. So the language that appears there now in A is actually what is intended for the LSWA license.
So I don't know if you can see our screen, Michelle.
Yep, I can see it.
So is section 6 correct now? Because the amendment that's on the screen is the one from this morning.
Okay, so actually it looks like it's now section 7. So if you could scroll down just a bit so I can see it. All right. Graduate with a bachelor's degree in social work from a college. Yes, that is correct now.
Okay.
The other piece that was incorrect was the scope of practice. It had diagnosis, which is not permitted within the scope
And
of
where is
practice.
that, Michelle, so we can see the,
It's the same section, Roman 2. So if you scroll down just a little
okay,
bit.
so scroll down a little bit. Yeah.
Yep, right here. The scope of practice for a licensed social worker shall be screening, assessment, treatment planning, treatment of mental health condition. Yes, that is now accurate.
Okay.
Previously, it said it needed to be under the supervision, under clinical supervision, but this particular credential allows after 2 years of licensure for the individual to work without direct ongoing supervision from a higher level clinician. The LSWA is the one that requires post-licensure continued ongoing clinical supervision. So this is accurate now.
Okay, great. Maybe stay on the line
Sure.
if there are any other questions on this amendment. I think
Okay.
Senator Sherman.
Yeah, I think OPLC had concerns on it. I don't know if they're on the call. Kirsten, is anybody from OPLC here?
I wouldn't know who I'm looking for.
So if there is anybody from OPLC, if you could raise your hand.
I'm currently not seeing any hands raised.
Let me see if I can find their email quickly.
So, I mean, this was moving pretty quickly and I have not sent it to OPLC. If there are some issues, I'd suggest a floor amendment next week.
Okay.
Okay.
Yep, that's fine. I think that's a great solution. Thank you.
So this amendment was the subject of pretty intense negotiations between the carriers. And Michelle, myself, Senator Whitley, I think we got to a reasonable spot.
And
that-
ASW.
And the social workers too. Yes, thank you very much. Yep. I think we've gotten to a reasonable spot that will increase the ability of bachelor level and associates level to get the licensure that is absolutely essential as we're trying to deal with a mental health situation. There's probably going to continue to be some ongoing discussion about credentialing, which is in the last section of the bill. I think, again, this is a compromise, and I think we need to see how it works. We want to make sure that, you know, facilities are credentialed and are able to serve the people that need their help. So, any rate, Senator Whitley, do you want to add anything?
Yeah, so I certainly appreciate everyone who is at the table working a lot. I mean, this is the result of a lot of negotiations, and I really do appreciate everyone recognizing that everyone needs to be at the table when we are looking to address the mental health crisis in New Hampshire. And this amendment will go a very long way to addressing the issue that we have talked about for a long time, which is the mental health workforce. We cannot get people the treatment that they need if we don't have the people to provide that treatment. So we all need to be at the table to address that issue. And I think this amendment will go a long way to help build the workforce pipeline by creating this pathway for professional advancement in the mental health field. And so I'm excited by it. You know, I think we also lay this foundation for sufficient reimbursement for a comprehensive array of services, which is also incredibly important. So I'm grateful to Senator Bradley and everyone who worked on the amendment.
Senator Sherman?
Yes, thank you, Senator Bradley. I just want to reach out and thank the carriers for coming to the table as well. And as they have said many times, this is an issue of providers. And as we have said many times, this is an issue of everyone stepping up and making it possible for us to provide the comprehensive mental health services that are needed. And I think the ability to move this forward demonstrates that the carriers understand that they're part of the solution, and this bill is one that will allow us to increase the workforce of reimbursable providers. And also it's the partnership with the carriers is critical to making sure this moves forward. So I just wanted to recognize their part in this solution.
Okay, any further questions, discussion? Okay, is there a motion on the amendment? Senator Whitley has moved on to pass, seconded by Senator Sherman. Okay, questions, comments? We'll start with Senator Avard.
Yes.
Senator Gray.
Yes.
Senator Whitley.
Yes.
Senator Sherman.
Yes.
And I vote yes.
Move to consent.
I'm not going to make the same mistake.
Move to consent.
Ought to pass as amended, moved by Senator Whitley,
Sorry.
seconded by Senator Sherman. I'll call the roll. Senator Whitley.
Yes.
Senator Sherman.
Yes.
Senator Avard.
Yes.
Senator Gray.
Yes.
What's everybody's pleasure? I mean,
Consent.
pretty big bill. Might not be a bad idea to keep it on the regular calendar, but if everybody else wants to go with consent, I don't have a problem with that.
I'm okay with consent.
Me too.
That's
Becky,
fine.
do you want to talk about it on the floor?
I mean, that's fine. I think we are, it depends on the timing. Next week is going to be a very heavy session.
It might be nice to have a 5-0 vote on the floor.
I'll leave it up to you.
Who moves consent?
I move consent.
All right, Gray moves and Senator Gray seconds. All right, Senator Whitley,
Yes.
Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Gray.
Yes.
I vote yes. Senator Whitley gets the honors on this one.
Thank you. And I just wanted to thank the committee for the support of this work. I think it's really important.
Okay, I think we're done our work for so far, except for concurrences committee at conference. Senator Sherman?
Just asking that if you wouldn't mind keeping me posted on what happens with Attorney Lehman on
Yep.
your amendment to HB 220. And I suspect the Medical Society would like to chat with you about their continued concerns before it goes to the floor.
Well, I think that the committee amendment of my amendment striking medical intervention significantly narrows the bill, but I'm happy to talk to them. So, any rate.
Thank you.
Anything else?
Move to adjourn.
Second.
Okay, I'll call the roll. Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Whitley,
Yes.
Thank you very much, everybody.
Thank you.
So we move out of exec, then adjourn, or do we?
Oh, well, you moved out of executive session. I'm sorry. Now Senator Avard is moving to adjourn.
Second,
Third?
All right, Senator Avard,
Yes.
Senator Sherman,
yes.
Senator Gray,
Yes.
Senator Whitley,
Yes.
and I vote yes too. Okay, great. Thank you all.